Aya Kamaya, and I am here with...
I am Thodsawit Tiyarattanachai.
Great. So we wrote this paper called Multicenter Study of ACR Ultrasound LI-RADS Visualization Scores on Serial Examinations, Implications for Changes in Surveillance Strategies. And this was just published in AJR. We're really excited about this paper, and we're excited to tell you about it. But before we talk about our paper, Thodsawit, can you tell us a little bit about yourself?
Well, I recently finished a medical school at Chulalongkorn University in Bangkok, Thailand. And after that, I received the Prince Mahidol Award Youth Program Scholarship from Thailand. And this scholarship supports my current appointment as a visiting instructor at the Department of Radiology, Stanford University.
Great. So our study, we looked at ultrasound screening and surveillance exams, and we focused on the visualization score. And the reason why we did that is because there is some question as to which patients should go on to alternative screening and surveillance methods like MRI. You can't do an MRI on everybody who's at risk for HCC, only some patients. And so we want to be able to inform which patients could potentially be better candidates for that by looking at ultrasound visualization scores, because for the most part, most patients should have screening and surveillance with ultrasound, but there's going to be a select few that may benefit from alternative imaging methods. So Thodsawit, can you tell us a little bit about what we did in our study?
Well, we conducted a multi-center study to determine the relative stability and changes of ultrasound LI-RADS visualization score on serial surveillance ultrasound examinations in patients at risk for HCC.
Great. So the three institutions we did this at were Stanford, UT Southwestern, and Parkland, and that was done with David Fetzer, who is also a co-author but could not be here today on this lovely afternoon in Palo Alto. All right, so what were our findings?
We evaluated approximately 9,000 surveillance ultrasound examinations performed in 3,000 patients, and we determined the frequencies of visualization scores remaining stable or changed after variable numbers of preceding examinations with a given score. We found that after a single examination with a score A, 88% of follow-up examinations also had a score of A. However, after a single examination with a score of B or C, only 40 to 50% of the follow-up examinations had a repeat score of B or C. And the frequency of repeat score C increased to 67% after two consecutive examinations with score C, and further increased to 80% after three consecutive examinations with score C.
Okay, great. So basically, if you have a visualization A, you're very likely to continue to have a visualization A, whereas if you have a single visualization C, you are still greater than 50% likely to change to A or B on a subsequent exam. And but if you have at least 2 or 3 exams that are C's, then you're more likely to stay C. So what do you think is the clinical impact of our findings?
Well, I think our study provides data to inform the rationale and timing of when to continue with ultrasound surveillance or to proceed with the alternative surveillance modalities in patients with visualization score C.
Great, thank you so much.
Thank you.